you imagine the CEO of a company taking a job knowing that this company really was hard-pressed to make it? Such was the case for Mike Rich. And he did so with a company back in 2008. It had no place to go but up. But ever since he jumped on board, that's the direction it has gone, and it has not stopped since. And he took a company that was on the brink of bankruptcy and now has turned it into a national power, doing so in the very competitive nursing home industry.
When you walk in the front door of any particular nursing home at Daybreak, one of the things I pride myself in is that people will say, hey, it doesn't smell like a nursing home. And that is such a quality statement that they don't even realize that statement alone, how important it is to us, because it says that we're doing our job and keeping that environment clean and safe and all those things that go behind that kind of environment, something so simple as it smells good.
I may be reviewing financial statements 1 minute, working on some IT strategy the next minute, and then working on due diligence for a dozen nursing homes that we may be looking to acquire on the next. And I think I enjoy most the ability to bring those various talents to the table. Have the respect of my peers and coworkers in the company, and to be able to help make a difference in where the company is going.
Medicare and Medicaid are a big focus for the country right now of what we need to do. And the biggest thing we need to do is understand that the payment system and the way it was incentivized for years was based on the more you spent, the more you made, right? And so the biggest change that's coming, and where I'd like to see us continue down that road, is to focus on necessities of what residents actually need, focus more on wellness. I think if I had to pick one area that's critical for healthcare, it's let's focus on the front end of prevention of people getting sick, focus on catching those illnesses before they become so complex or so difficult, or someone turns so sick that they have to go to the hospital and receive that very expensive care at that point. In nursing homes today, that's one of the things we focus on as much as we can is prevention. But as an industry, having programs, having the personnel and the expertise to focus on wellness is where we really need to put our dollars. And I believe that's where we're headed.
I saw some real opportunities here. There were a lot of areas that the company had challenges with that I had actually worked on and helped correct it in prior businesses. I spent quite a bit of my career in the healthcare consulting arena, and so many of the departments and areas that the company had their greatest challenges with were areas I'd been able to affect in prior companies.
We operate SNFs, skilled nursing facilities, and the biggest misnomer to the general public out there is that they don't understand the difference, let's say, between a SNF and a assisted living is we do have nurses, LVNs in Texas, LPNs in many other states, and RNs around the clock. And the difference is the medical necessity that a person needs around the clock to come here. For example, if a person comes, and we have family members all the time that contact us, and they say they need help with bathing, need help with eating, dressing themselves, remembering medications, that's assisted living. And we manage heavy, complex medical residents here. And you walk in and you see a home-like atmosphere, which is what we want to provide, but truly our residents, simply put, are very sick.
The type of culture that Mike breeds within the company is certainly a team culture, and we leave our egos at the door. He certainly promotes that type of environment where we can say what we need to say, we can call each other out on things that need to be changed or done differently, and he's very open to everyone's opinion on what needs to be done. So, you're not operating in this company in a vacuum. It's a team approach. We're all able to contribute, along the way in every aspect of the company.
I just wondered what it was that really set you apart in this industry and what made you unique.
Number one was just relationships with our vendors and the people we did business with. I met with them, and basically I had a simple conversation. I say when I go to a boardroom, I know I'm not the brightest guy in the room, but I'm going to sit there and talk very plain and very honest and open about what the situation is. So the first move that I did was I went out to all our vendors and said, do you want 100% late or 10% in bankruptcy court? And I said, it's that simple. If you'll work with us, I believe we can pull it out. I believe we can do some good things, but I need your support. And then the second thing was bringing in Mike Wallace to manage all of our financial needs, our lender relationships that had turned sour, and our IT department, which was also well behind the times.
Really started was getting the ship right-sized and turned in the right direction and moving in the right path, recreating a culture for the company, and then beginning to work on the infrastructure. And from there, we've been investing money in our nursing homes at a very nice, steady rate, improving the physical structure and trying to work on the environment for for the folks that are in our care. So I think where we are now, looking toward the future, we're looking at adding additional homes and businesses onto what we have. So we have a nice platform now. There's still some things that we need to do to finish it. I believe growth is definitely the next step that we're going to be working on.
Let's go back to 2008. Why did you get involved?
When I left this company in 1992, here I returned in 2008, and really I can't say I was a guy on a white horse. I'd say I was a guy coming in to help manage what was going to be a bankruptcy. And when I looked at it, yes, I said, you know, the idea is bankruptcy. Nobody was expecting us to improve the operation just to get through it. And as we sat down and looked, one of the advantages that I had in watching my mother's work for all those years was understanding the culture and really understanding, I felt, the leadership and the vision that was needed at the time. And that's when I sat down, as I indicated before, and thought real hard about what they needed. And when I came to the company, I thought about the core values that I thought were important to turn the company around. And when I stepped in the door, it's exactly what I did. One of my first comments to the board was, I will spend us into success, I will spend us in failure, but we won't do business as we've always done. And that's been kind of my mantra since we've been here, is we're going to do things differently. We're going to take a different path, and if it works out, great, and if it doesn't, we'll learn from that and move in another direction. But status quo and doing things the same way and expecting a different result, I knew wasn't going to be the way for us to move the company.
Mr. Rich says, we as a team have taken a failing organization in so many areas, and we've hired the financial people, the clinical experts, the operational managers, and marketing and sales-minded teams because we want to be a leader in the industry, and we're doing the right things to get there. Mike says they're not there yet, but they're certainly headed in the right direction. Relationships, integrity, and trust. It's what's making Daybreak Ventures a leader in the industry.